My name is Shaniqua, and I'm a social worker here at the African American Health Program, also known as AAHP. And here at AAHP, our mission is to eliminate health disparities and improve the number and quality of years of life for African Americans and people of African descent in Montgomery County, Maryland. And we do that by providing health education, referrals, and resources to those in need, and across 6 different focus areas. And one of our major focus areas is sexual health. So we've developed a mini-series to bring this information straight to you, wherever you may be watching from. And in this series, we will discuss sexual health facts, the importance of talking to your partner, which includes consent, how to find a trusted adult, and of course, some local resources for more information and free testing centers. So if you're looking to hear more information about this topic, please continue watching. And if not, please check out the link below and visit our website where we offer information on other health topics affecting our communities. And now I present to you Mrs. Adrienne Barksdale, who is a licensed social worker here in the DC, Maryland area and a professional sexual health educator. Adrienne, take it away.
What are STDs, STIs, and Mythbusters? Sexually transmitted diseases, also called sexually transmitted infections, affect people of all ages, backgrounds, and all walks of life. In the United States alone, there are approximately 20 million new cases each year, half of which occur among youth ages 15 to 24 years old. While anyone who is sexually active is at risk of getting an STI, women, youth, and people of color are more likely to become infected. What is HIV? HIV stands for Human Immunodeficiency Virus. So, imagine your body as an army. HIV attacks the part of your body that fights diseases, which is your immune system, and makes the immune system not work right. Sometimes, there are no signs of HIV at first. The only way to tell if someone has HIV is a blood test. Also, many people with HIV look healthy and can still transmit the virus. According to the Center for Disease Control and Prevention, more than 8,000 youth were infected with HIV in 2018 in the United States. How is HIV and STI spread? STIs are usually spread through sex, vaginal, oral, or anal. STIs can be spread through any contact between the penis, vagina, mouth, or anus, even if there is no penetration. For example, genital herpes is spread through skin-to-skin contact without penetration. Another example is HIV and hepatitis B. Both can be spread through sharing needles for injecting drugs, medicine, or even tattoos. Here is a list of some common STIs: gonorrhea, chlamydia, syphilis, HIV, herpes, and HPV. How can I protect myself from STIs and HIV? There are a lot of ways to reduce your risk of getting a sexually transmitted infection. Of course, the most effective way to prevent STIs in pregnancy is to not have sex at all. For those who do choose to become sexually active, there are ways to reduce your risk of contracting STIs. Communicate with your partner about using condoms, get tested regularly, and know you and your partner's status. Limit the number of partners you have and avoid alcohol and drug use. Now, let's debunk some myths. I can get an STI from a toilet seat. False. STIs generally die quickly on surfaces and have a hard time living outside of the human body. I can't get an STI from oral sex. False. You can contract an STI from oral sex. A girl can't get pregnant her first time having sex. False. Depending on her cycle, she may become pregnant. You can use a condom more than once. False. Condoms are only good for one use. Use a new condom every time you have sex. Get tested. Talk to your partner about condoms. Your sexual health is important. You have the right and responsibility to protect it. Consent and condom negotiation. Consent is something that is ongoing and needs to be given before engaging in any type of sexual activity. All parties need to openly agree on the activities they want to engage in, whether it's kissing, touching, intercourse, or anything else. It's important for everyone to feel comfortable with what's happening. Consent during sex is important. While in the moment, some ways to check in with your partner can be done by asking, "Are you comfortable? Is this okay? Do you want to slow down?" Remember, consent is ongoing, and communicating every step of the way is important. Like asking your partner if it's okay to take off their shirt and not assume that it's okay. Consent needs to be clear. If someone stays silent, doesn't respond, seems unsure, or says maybe, they are not saying yes. Saying yes while under the influence of drugs and alcohol is not considered consent. Also, saying yes because you feel pressure or feel scared to say no is not consent. Now that we have covered consent, let's talk about condom negotiation. Condom usage is something you and your partner should discuss prior to engaging in sex. There are ways to start the conversations with your partner. You could say, "I want to protect both of us, so let's wear a condom." Now, we know it may not be that simple, and you may be faced with some excuses, so let's address some of those as well. If your partner says, "The condom won't fit," your response could be, "Let's try it anyway," or "Get another size," or "Use the internal or female condom which fits everyone." "I can't feel anything." You can say, "We can relax more and feel more with condoms because we don't have to worry as much." Hopefully, these can work for you. Remember, consent is a must. Never feel pressured to have sex, and always wear a condom. A trusted adult is someone you can have an open and honest conversation with about sex and sexuality. This person doesn't always have to be a parent or a guardian. A trusted adult should be someone you trust and you are comfortable talking to. That could be a teacher, a coach, social worker, doctor, family member, or even a neighbor. We want our trusted adults to have our best interest at heart. Some ways to identify if someone can be a trusted adult is by asking them if it's okay to talk to them about something that is important to you. Remember that these conversations may be uncomfortable for both of you, so start slow. Conversations with your trusted adult can be ongoing, so at any time it becomes too much for you, take a break and pick back up later. If you're still not convinced it's a good idea to talk to an adult, consider this. Your parent or any adult are sexual beings themselves, and at some point in their lives, they had to make the same decisions you're struggling with right now. The internet and other media can't give you the answers to address your unique background, personality, and intelligence. Only people who know you can do that. Here are some approaches you can take to start the conversations with your trusted adult. I heard someone say, fill in the blank, followed with, is that true? Some of the kids at school are doing, fill in the blank. I want to know what you think. I saw this movie, TV show about fill in the blank. What does that mean? What was dating like when you were my age? Did your friends ever pressure you into having sex or doing something you didn't like? I'm worried about my friend and I want to help them. What should I do? Remember, talking about sex with your trusted adult should be an ongoing discussion. Thank them for taking the time to listen and help. Your sexual journey is just beginning. You have the time to consider your options and the people who help you make healthy decisions. Take advantage of both. Be one of the lucky ones who listens, learns, and loves wisely. Influences and decision making. When it comes to making important decisions about sex, we want to make sure to inform you of all of your options, even abstinence. Abstinence means you are not having any kind of sex with anyone else. That does not mean you can't hold hands or kiss your partner. We are saying that if you choose to be abstinent, that you don't have sex of any kind. Abstinence is and will always be the most effective way to avoid a sexually transmitted disease or infection or unintended pregnancy. While condoms, when used correctly and consistently, can protect against both STIs and pregnancy, other forms of birth control may protect against pregnancy, but not STIs. Taking care of your sexual health is essential. Having sex is a major step. Don't be too embarrassed about asking questions and communicating your thoughts with your partner. They may be feeling the same way you are and are unsure of how to approach you. If you feel you are comfortable enough to have sex with them, then you should be ready to have the conversation about it. The effects of drugs and alcohol can make it hard to think clearly, let alone make the best possible decisions about sex. While you're under the influence of drugs and alcohol, it is easy to make a decision that you may regret later. In some cases, people may use drugs and alcohol to make you have sex with them. Avoiding drugs and alcohol reduces the risk of contracting STIs, having unintended pregnancy, and being coerced into having sex. Before choosing to have sex for the first time, ask yourself, am I really ready to have sex? Am I doing this for the right reason? How do I plan to protect myself and my partner from STIs and pregnancy? How am I going to feel about my partner after? Also, let's keep in mind that there may be other influences around us, such as social media, family, and our personal values. Remember to be true to yourself and only make the best decision for you. Pay attention to your feelings and don't let anyone make you feel guilty for making decisions that are right for you. Again, only you can decide if you are ready to have sex. No one ever has the right to pressure you into having sex. It can be hard to say no, even if you want to make that person happy, and you may feel bad about hurting their feelings, but you always have the right to say no. Make sure to do what is best for you.
The African American Health Program is funded and administered by the Montgomery County Department of Health and Human Services and implemented by McFarland and Associates, Inc. This material may be reproduced.